In this talk, I will be discussing the systematic review on the timing of surgery and the treatment options available for perilunate injuries. This is a collaborative research between the Erasmus Medical Center, the Amsterdam University Medical Center, the University Hospital Birmingham, and Kuthikpat Hospital. Though uncommon, about only 7% of injuries in the wrist are pertain to carpal injuries. However, they are often misdiagnosed, with more than 1 in 4 having not been detected at the time of injury. The obvious thing is whether acute treatment with early diagnosis provides better outcomes. Immediate reduction, obviously, in carpal injuries will reduce the pressure on the median nerve and therefore reduce nerve injuries. And also, the dislocations will result in chondral necrosis of the cartilage, and surgical fixation as soon as possible is generally logical. Now, Mayfield's classification is very clear on the types of lesser arc and greater arc injuries as shown in this slide, and we are familiar with the staging in Mayfield's classification from stage 1 to stage 4. The lesser arc injuries tend to be ligamentous in nature with perilunate dislocation, whereas greater arc injuries may be associated with fractures of the carpal. So, the aim of this research, the systematic review, is to understand perilunate injuries and the treatment options which are superior for these injuries and the best time for treatment. What are the outcomes for late treatment? And is there a consensus regarding post-operative treatment and period of immobilization? So the inclusion criteria for this research has been those who have sustained perilunate dislocation or perilunate fracture dislocation. Any form of surgical intervention, irrespective of the time of surgery, were included, and they must have reported physician reported outcome measures in the study. For example, the Mayo risk score and a sample size of at least 5 cases. The exclusion criteria are clearly stated in. So the framework for the systematic review was a literature search was performed on April 23rd, 2020, and with the following data was the PICO's framework. I'll come to that later. The search strategy uses the various search terms as here shown here, and is available as an appendix for those who would like to know the strategies used for the search of the articles. Prisma guidelines were used, and the selection criteria was based on our eligibility as mentioned earlier. And data extraction and synthesis was performed by researchers using the quality guidelines as recommended by the Center for Evidence-Based. Here's the PICOS framework that we use for this systematic review. The population obviously were those who had injuries with either perilunate dislocation or perilunate fracture dislocation, and intervention was any surgical management or for the injury. No comparators were used in this systematic reviews. The outcomes measures were basically those of physician-reported outcome measures pertaining to like the Mayo risk score. The study design was such that any case reports or series where there were more than 5 clinical cases were taken into. This is the Prisma diagram. We had 3,762 cases that were detected using our search strategies, and following deduplication of the materials, we had 2,056 records available for screening, and from this there were 16 studies that were fulfill the eligibility criteria for the systematic review, and they were available for data extraction and a quantitative synthesis of the available data. So 16 studies were incorporated. This is the qualitative evaluation of the quality of the studies that were included, and in this you can see the various questions, the 8 questions that were used to as a framework to assess the quality of those papers for systematic review analysis. So when we pooled the data, we had 365 patients, of which 55 were delayed, the rest were acute, and there were 107 chronic treatments. And so here we see the various types of treatment, which is closed reduction and internal fixation, and open reduction and internal fixation, and other types of treatment. Majority of the cases had fracture dislocations with with the PLFDs. Post-operative regime varied greatly, adding to the heterogeneity of the studies, and most studies reported an immobilization of at least 4. Here are some of the details of the patient numbers and the various treatment options and post-op therapy from the papers that are included in the systematic review. So you can see the heterogeneity of the data and the types of treatment that was uh, uh, used in these studies. So what is the implication of this systematic review? We generally found the delay in treatment in all the studies range from 7 to 45 days, again showing the lack of index of suspicion in diagnosing this injury. In the acute setting, closed reduction and internal fixation seems to be a better strategy with better outcomes, whereas chronic, more than 45 days of injuries, especially with the lesser perilunate injuries, resulted in worse result. Those with fracture dislocation, open reduction, and internal fixation produce superior results. Close reduction and internal fixation in both the fracture group and the pure perilunate dislocation showed no inferiority of the close reduction to that of open reduction. So close reduction without repair of the scapholunate or the lunotriquetral ligament did not show inferior result as compared with open reduction and repair of these ligaments. So the treatment of perilunate injuries in the delayed or chronic situation are usually with very poor outcome, and one needs to consider salvage procedures like proximal row carpectomy and wrist arthrodesis in your armamentarium for the treatment of these injuries. In conclusion, this systematic review has shown that those patients with perilunate and fracture dislocation, that is the greater arc injuries, the scapholunate and the lunotriquetral ligaments remain intact, and the stable fracture fixation, either by open or closed techniques, usually results in a stability as compared to pure perilunate dislocation, that is the lesser arc injury, where both the SL and LT ligaments can be injured. So proximal row carpectomy in the acute phase can be a consideration because of the shorter operating time and shorter immobilization required for those chronic cases. One may want to consider arthrodesis with the significant amount of cartilage damage. Early hand therapy does not seem to result in worse outcome for those who do not have such treatment. Again, the limitation of this systematic review is the retrospective nature of the studies included in the observational studies, the heterogeneity of the data, with this degree of disconnect between the severity of the injuries and the treatment, and we only included studies with physician reported outcome